getting into pneumonia or lung involvement with COVID-19. So seek medical help or go to the hospital. Now, there are cases, usual cases are over resolved in 10 to 14 days. Some may linger a little longer, but there are cases which can linger on for months and months, and that is called long COVID. I will come to the long COVID. Uh, Usual mode of transmission is person to person, individual to individual, by droplet infection. That means you cough, you sneeze, uh, the virus spread in the bigger droplet 6 feet away from you. That is why the distance rule within 6 feet, maintain more than 6 foot distance, because the droplets do not spread more than 6 foot. They spread within a distance of 6 feet, so virus can go from one person to another within 6 feet and not beyond. They are also described aerosol transmission, which means much finer particle containing the virus is spread over a wide area beyond 6 feet in the air. That mode of transmission, so far, aerosol, called as aerosol, by CDC, they say this is controversial. The only thing which we have established by evidence based medicine is the droplet form of transmission, which is usually within 6 feet, not beyond 6 feet. Now, there are people who may contract the virus, have the disease, but they may manifest no symptoms, zero. And children, particularly, may be largely asymptomatic or have very mild disease. But even if you are asymptomatic, no symptom, you can still transmit the virus to another person which is within 6 foot of you. So remember, asymptomatic transmission can occur. Uh, Adults with the pre-existing diseases like hypertension, chronic obstructive pulmonary disease, heart disease, and diabetes mellitus, or age group more than 65, are much more prone to develop symptoms and including severe disease by COVID-19. The common tests are: one is nasal antigen, which is dependent on the protein of the virus. So we detect the antigen, which is the protein from the virus, and that is a quicker test, will give you an answer in few hours. Abbott lab has even devised a home testing with the rapid antigen test. But however, in the antigen test, keep in mind there are false negatives. So a lot of people, or some people, I shouldn't say a lot, some people may have COVID yet may test to be negative by the nasal antigen rapid test. So the only definitive test is called nasopharyngeal swab and doing what is called PCR, RT-PCR, polymerase chain reaction, which detects the nucleic acid of the virus rather than a simple protein of the virus. That is more definitive test, may take 2 days or even longer to be reported. That is a disadvantage. So, uh, I will come to detailed protection later on, but 6 foot distance and masking and washing hands, as we all know, is very essential, along with limiting our travel. All right, incubation period, usually 14 days, but symptoms appear within 3 to 5 days in most of the people who have contracted the disease. So let us say between 4 days to 14 days. By 14 days, symptoms should appear because that is the maximum incubation period. That means from the time of exposure to the development of symptoms. So incubation period, keep in mind. Uh, if you if you are exposed to COVID and have milder symptoms, you can stay at home. Isolate yourself, self quarantine yourself, let your family know you have COVID 19, you have tested positive within 3 to 5 days after being exposed to somebody who has COVID 19, and you isolate yourself. Your utensils are separate, your clothes are separate, your bed sheets are washed, linen is washed separately, and you use your own bathroom which is designated for you. After 10 to 14 days, fever is down, fever is down more than 24 hours, and you have no more symptoms. You can come out of isolation, but before you come out of isolation, get a repeat testing done. Usually it should be negative. However, there are people who have no more symptoms, no more fever, yet their test may remain positive for several weeks, and that does not mean by CDC continued infectiousness. So, positive test beyond the first 2 weeks does not equate to your being infectious beyond 2 weeks. It is only that test which remains positive. All right. Now, as you know, most cases, as I said, are mild, but the pneumonia occurs in about 20%, 1/5 of patients who have contracted COVID. And pneumonia can be milder pneumonia, but it can end up in what we call ARDS, acute respiratory distress syndrome, which we used to take care of in the ICU all the time. Uh, and now, ARDS is characterized by falling oxygen level, which we call hypoxia, and also associated with hypoxia are the increased inflammatory markers like CRP, C reactive protein is elevated, IL-6, interleukin 6 is elevated, increased cardiac enzyme troponin, increase ferritin level, increase the sedimentation rate. All of these inflammatory markers are elevated when you have pneumonia, indicative of severe diseases. Now, ultimately, ARDS and pneumonia can lead on to sepsis as well as result in hypotension and cardiac heart abnormalities in the form of an MI myocardial infarction or even heart failure. So those are severe cases. Overall mortality in this disease is between 2 to 3%. Remember, with the ordinary flu, the mortality is 1.2%. Here, the mortality with COVID 19 can approach almost 2.5 times to 3 times that of flu. So it's much more deadly than the flu. All right.
Dr. Naresh, can we ask questions or should we wait till
I
end?
know. I think wait till the end.
Okay, thank
Yeah.
you.
Yeah. No down. Down. Okay. Now, uh, as I said, you can get your heart involvement in severe cases, and heart involvement can also lead on to irregularity in heart rate and rhythm, arrhythmia. And of course, the COVID 19 is associated with what we call hypercoagulable state. That means blood clots easily, you got blood thrombi and clots. People can get strokes, mini strokes or major strokes when they have severe COVID 19. You can get clots in your leg arteries causing ischemic changes. Sometimes the extremities may have to be amputated. You can get the clots in the abdominal artery. So everywhere you can get the clots. So that is the thrombotic events with the COVID 19. Now, when it comes to reinfection can occur after the initial infection within the next few months, but it is a rare, it's not very common. So keep in mind, reinfection, even though cannot be ruled out, yet it is an uncommon event after the initial infection. Risk of your dying is increased with increasing age more than 65, as well as with the underlying pre-existing diseases which I already mentioned. Now, sometimes in children, as I said, children usually do not get severe disease. They usually have disease, milder disease, and many times children may be asymptomatic, yet may be able to transmit the disease from themselves to their friends or to their parents. So keep in mind, children can be big sources of transmission when you do not even know that they have the disease because they have no symptoms. However, a minority of patients, children, develop what is called multi-system inflammatory syndrome, MIS-C as in Charlie for children, MISC, that is due to their hyperimmune reaction to the disease, to the virus, in which inflammatory agents, what we call inflammatory cytokines, are released so widely in the body, it's called inflammatory storm. And those kids have a very, very poor outcome. All right. Now, briefly talking about the variants. We first discovered a highly transmissible or more transmissible variant in UK, which was called B as in boy 117. And that is now the predominant variant causing the disease in England. But that has also spread to many states in the US. It has also spread to Canada. It has also spread to Europe. It has also spread to India. Then they have a highly transmissible variant in South Africa, which is called B11351. Then they have the Brazilian variant variety, which is called P as in Peter 1. Then they have their own indigenous California 424 and 427 mutants. And now in India, they have a very deadly mutant, which is the 617. I presume, that is my presumption, that poor Dr. Rajendra Kapila, who was totally vaccinated before he went to India, had even his antibodies checked before he traveled to India, and yet succumbed to COVID 19 in India and died. And I think that was due to the variant 617, which is highly prevalent and spread all over India. Remember, more and more variants, mutants will arise every day if the virus is jumping from host to host and is replicating at a rapid rate. These viruses are very smart, like the bacteria, who develop resistance to the antibiotic we use to combat them. Viruses know you are using a vaccine, they get smarter to resist the vaccine. They develop mutation in the spike protein. Now, spike protein are the crowns which are standing up on the coronavirus. That is why it's called corona, because of the spikes which are coming up. And that spike represents, sorry, spike is the spike protein of the virus, and the mutation always involves the spike protein, the resting domain of the spike protein, the region that the virus uses to attach itself to the host cell. So keep in mind all mutations occur in the spike protein that the virus is using to attach to you and me. So the variants are very bad. And they are more transmissible, may not be more deadly. I do not know about the India 617. Maybe it's even also more deadly. But the UK variant, the South African variant, the Brazilian variant are more transmissible, but may not be more deadly, and vaccines, which I'll talk later, are active against them, but not to the same degree as they're active against the original Corona 19 SARS 2. So keep that in mind. Now, as I mentioned, long COVID or the COVID long haulers are the patients who develop symptoms beyond 4 to 6 weeks. Most of the COVID symptoms should regress by 2 weeks, 3 weeks at the most. But there is a percentage of patients, sorry, percentage of patients who continue with the ongoing symptoms, lingering symptoms, which last for several months after the initial infection. And some of these people may be originally asymptomatic or may have very mild disease, yet they go on to the long COVID syndrome. Who knows what is the reason? Whether it is a hyperimmune system in their body, we as yet do not know. There are too many things not known about COVID 19 because it's so new. All right. So, the long COVID symptoms consist of brain fog. Almost everybody describes their brain fog. That means they are not able to concentrate. They are not able to focus. They are confused, semi-confused. And then they have headaches. They may have chest pain. They may have irregular heartbeat, heart rate going up or going down. They may have myalgia, fever, fatigue, PTSD type of syndrome, depression. So this is a nasty, nasty thing to have long COVID. One of the guys I heard about a month ago who was managing a chain of restaurants in Texas developed long COVID. The guy was so depressed, He said, I cannot take it. He took a gun and shot himself. Suicide with the long COVID. Also, I must mention, which Madhu, who is here, had loss of smell and loss of taste can linger on with COVID long haulers. But it's because they are saying brain, olfactory lobe but the brain is involved. Olfactory nerve which carries a sensation to olfactory lobe of the brain is also involved. What causes these things to be involved when we have never seen such a thing in any other disease? God only knows. We do not know much about COVID 19, why it does what it does. All right, now management. Again, these are all big topics by themselves. I'm just giving you overview to be able to finish in time and get to the question. Management. Best management for mild COVID is at home. Stay home, isolate, self quarantine yourself, do not come in contact with your household contact. Just tell them you have COVID, keep everything separate and isolated for them. And usually that is the best. Symptoms resolve within 10 days to weeks. Now, if you feel you are getting more than mild disease, you would know it. Your symptoms are not just a simple symptom. You're beginning to get some chest discomfort. Fever remains very high. You're getting a sensation of mild shortness of breath. That is a red line. And if you have the facility of keeping a pulse oximeter at home and the saturation on your finger is less than 94 or 93, that is absolutely a red line. You need to call your doctor or call the hospital, get evaluated there. You may be getting into more severe disease. Now, that is the time between 3 days to 10 days after the onset of symptoms, if the symptoms are already going to moderate degree to get monoclonal antibody treatment. You got to tell your physician, hey, am I a candidate for monoclonal? Hospitals are hiding this monoclonal one side because problem is when you have to give somebody monoclonal, you have to get them in a separate area with a cordon off so you are not in contact with other patients to transmit the infection. And a nurse has to be assigned to you who is only for you. And after giving you infusion, she has to make you wait and observe you for 1 full hour because allergic reactions are common and often seen after the monoclonal antibody. So that's why hospitals are not encouraging it because they have to have separate personnel, separate space, and nobody wants to get in there. And in India, I recently advised one of the families. I said, have the person get monoclonal antibodies. Naresh, there are no monoclonal antibodies in India. Monoclonal antibodies is not a cure, but they will shorten the time to recovery and they will not let you usually get onto the advanced stage. So keep that in mind. You may have to tell your physician, hey, I am a candidate for monoclonal. There are very specific antibodies made directed against the virus itself. Are the monoclonals as effective as the variant against the variant? No. So if it's a variant situation analyzed by a genomic sequence, then if it's a variant, you cannot use the monoclonal. All right. Now, if you do get into more advanced condition, and your saturation of oxygen is going down. You are on nasal cannula, nasal tubing between 2 liters, 4 liters, 5 liters, and you are having difficulty in maintaining oxygen saturation or adequate oxygen level, you may then be a candidate for remdesivir. Remdesivir, remember this drug. Very good. It is an antiviral drug which nullifies RNA polymerase, an enzyme of the coronavirus, and therefore neutralizes the virus. Very good drug. Again, America has ample supply. Our ex-president Trump got both monoclonal and remdesivir. That is why he sling up very fast. So did Rudy Giuliani. So did Ben Carson. So did Christie. All these people are lucky because of their position, and they had no position and no problem getting monoclonal or remdesivir. Ask an ordinary patient who goes to the hospital. Ask him to tell the doctor to give him remdesivir or monoclonal. There will be 10 different excuses given to the patient. Trump did declare that everybody can have monoclonal, but that is not a practical reality, my friend. That does not happen. All right. Now, uh, let me go to the. All right. Now, in the hospital care, you are cutting the oxygen first with the nasal tubing, 2 liters, 6 liters. It is still not maintaining your oxygen level above 93%. In that case, we can put them on the full face mask and give them 100% oxygen. If that is not successful, we can then give them what is called pressurized mask or non-invasive ventilation as contrasted with intubation and ventilator, which is invasive. So non-invasive ventilation utilizing 100% oxygen mask but putting pressure inside your mask, which is called CPAP, continuous positive airway pressure, or BiPAP, which means separate pressure during inspiration and separate pressure during expiration. I use those modalities in too many patients and avoided them to be intubated and putting them on the ventilator. Now, if everything fails because your lungs are clogged up with that thick, protein rich fluid due to COVID, as well as all the cells which have accumulated, you may have no choice other than being intubated and placed on the ventilator. That should be the last resort. People on the ventilator have more than 50% mortality, and I'll tell you why. Ventilator is a fine machine. You set up a tidal volume, that means a volume which needs to be delivered to the lungs of the patient. Dial it at 6 cc's per kilogram ideal body weight or predicted body weight. Now, the ventilator will generate enough pressure to deliver that set tidal volume to the lungs of the patient. Now, lungs are already clogged up with a protein-rich inflammatory exudate, thick edema fluid, and lungs are not compliant anymore. As soon as oxygen under pressure is being delivered by the ventilator, Lungs cannot tolerate it because there's a high pressure by the ventilator. So lungs bust. Air leaks out and causes collapse of the lung, which we term pneumothorax as well as pneumomediastinum. Then we are left with the chest tube and vacuum the air out to re-expand the lung and all the other complications, including subarachnoid pneumonia, follow. So ventilator is the last resort. And I have to tell you, a physician with a pulmonologist and intensivist has to be highly trained to handle a ventilator in ARDS situation or acute respiratory failure condition because we used to use lot of strategies. Permissive hypercapnia. That means let the carbon dioxide rise up at the expense of low tidal volume to maintain lower plateau pressure less than 30 centimeters of water in the lung. We used to adjust our positive and expiratory pressure to the lowest degree so lung does not have adverse effect of barotrauma and basomer. There are so many other strategies, including giving them inhaled nitric oxide, which is a vasodilator, pulmonary vasodilator. Do everybody in India know all these facts? I doubt it. The training in the US is so high. We have to go to workshop how to manage a patient on the ventilator every year and pass exams on that. So I do not know all over the world that training and the care on a ventilator is the same. Plus, remember, patient is going to fight the ventilator because the ventilator is going to push oxygen or air, and the patient is not ready for such high pressure. Patient is going to buck, B-U-C-K, buck the ventilator, fight the ventilator. Patient is breathing out when the ventilator is giving an air inside. So in order to sync the patient with a machine, you have to completely paralyze them neuromuscularly and sedate them completely, putting them in the medically induced coma. To me, it's not that. Anyway, but you have to if you have to. Now remember, at the stage when you have the patient on the ventilator, you can use IV steroid, dexamethasone. That is really found to be beneficial, evidence-based. Dexamethasone IV will help you in acute respiratory failure due to COVID-19. And now recently I've been studying another drug which is IL-6 inhibitor, interleukin 6 inhibitor. It is called the tongue twister name, tocilizumab, and very specific IL-6 inhibitor. Very good result when used with the IV dexamethasone or steroid, not only in adults but also in children who have multi-system inflammatory syndrome MIS-C. So save life. Right now coming okay. Now if all else fails, all these techniques I have been trying to talk about, ventilator strategies to manage a difficult patient, you can then send the patient for ECMO. Now, during my time at Hackensack Hospital, we did not have ECMO. ECMO is extracorporeal membrane oxygenator, just like a kidney machine, a dialysis machine. Blood is taken out of the body, it is carbon dioxide is removed, oxygen is pumped in, and then the blood is returned back till such a time that your own lungs have recovered. ECMO, ECMO. I did not have the opportunity to use the ECMO myself because we did not have it. Only Mount Sinai in Colombia at that time had it. So keep in mind, if all else fails, ECMO can be useful to save your life. Okay, now uh, coming on now a little bit to prevention and protection. Oh, that's an important topic. First of all, there's no drug which is supposed to prevent COVID-19. So forget if somebody tells you, oh, we have this hydroxychloroquine or doxycycline. No, there is no proven drug to prevent COVID-19 so far. In the future, we do not know. All right, now, but the best prevention, and I know um, I'm told to emphasize how to prevent. Best prevention is the vaccines, vaccines, vaccines. There is nothing else as useful as getting fully vaccinated to prevent COVID 19. And you know, in December of 2020, they gave emergency use authorization to two of the fantastic innovations, the messenger RNA vaccine. One was by Pfizer with their German partner BioNTech, and the second was totally American, Moderna, in association with the Massachusetts Institute of Technology, MIT. Under Operation Warp Speed, these scientists worked day and night to create a vaccine which usually takes 10 years or longer within 1 year. And the vaccine also went through all the safety checks, phase one, phase two, phase three. And in the phase three, they had 40,000 patients in each one with Moderna and Pfizer. And 20,000 got placebo, saline, and 20,000 got the vaccine. They found 94 to 95% protection to the Pfizer as well as Moderna. And other group with the placebo, too many got sick with COVID. So protection is real. Protection is 94 to 95%. May not be the same against the variant, but now it shows even though they may be 70-80% effective against the mutant, yet they will prevent severe disease due to the mutant. They will prevent you from getting hospitalized and dying. So that is a big plus with the vaccine. Now, what is an mRNA vaccine? I know I have talked about it in my last two talks. Briefly, computer synthesized outside, no virus, computer synthesized fragment of the messenger ribonucleic acid mRNA is injected in the host cell, muscle cell, and there in the cell it gets only in the cytoplasm since the coronavirus is an RNA virus. So messenger RNA synthesized in the lab can only stay in the cytoplasm or the outer part of the cell, does not penetrate the nucleus which contains our DNA. So cannot alter your DNA. It stays only in the outside. And now, when it is in the cytoplasm as a messenger RNA, it codes for the same spike protein as is on the top of the virus. Once the body sees, hey, there is a foreign intruder, body produces. What a beautiful body everybody has. Body generates antibodies. both neutralizing and binding, as well as it generates what is called T as in Thomas, lymphocytes, which are the killer lymphocytes. So both the killer lymphocyte and the antibody neutralize the virus anytime it begins to attack the body. So that is how the mRNA vaccines work. Do not penetrate the nucleus, cannot alter your DNA, and also no virus is introduced in the body. You will not get a coronavirus from the vaccine. Now the third vaccine, which is approved, and you must have heard a lot about Johnson and Johnson. It had initial hiccups. Johnson and Johnson is only one dose. Both Moderna and Pfizer require two doses, and the immunity is not complete unless 2 weeks after the second dose with the Pfizer and Moderna. Johnson and Johnson one dose vaccine does not require extra cold storage the Pfizer needs, and only one dose. Full immunity is achieved 28 days after the Johnson and Johnson one shot jab in your arm. Why there were hiccups? Now that vaccine uses the adenovirus vector platform. That adenoviruses are very common, like coronaviruses. They share with the coronavirus same antigenic spike protein structure. So what the scientists did very smartly, they changed, modified the adenovirus so it cannot multiply in the human body. And they introduced it in the body, in the muscle cell. And there it does penetrate the nucleus because adenovirus is a DNA virus, and there is excited formation of spike protein, and body then produce antibodies and the killer T lymphocyte. So the mechanism is very good. AstraZeneca uses the same adenovirus vector platform. However, it uses adenovirus which is from chimpanzee, chimp. Adenovirus in Johnson and Johnson is adenovirus number 26. Now, initial hiccups, problem, and pausing of Johnson and Johnson was because it can cause very severe, mark my word, but very rare type of blood clot. And these clots occur in the brain, which is called cerebral sinus. That cerebral venous sinus drains the blood out of the brain, so new blood can enter but cannot be drained out because the sinus is clogged up by a thrombus or a blood clot. They can also cause the same clot in the leg, in the abdominal area, and other areas. Now, why that happen? Again, cases are there, roughly in 1 million. 1 in 1 million. So cases are rare, but it does occur. And once it occurs, one or two people died. Rest had to be treated in the hospital. But that treatment is not easy because mechanism of these blood clots is similar to what we used to see in the hospital with the commonest blood thinner called heparin. Heparin IB is the most common blood thinner in case you have blood clots in the lung or in the veins of the leg. So, happening at times caused a reverse problem, which was called happening induced thrombotic thrombocytopenia. Thrombocytopenia means low platelets. Platelets are the one which govern your bleeding, like the red blood cell, white blood cell. Platelets are concerned with the control of bleeding. So hyperimmune reaction to the Johnson and Johnson vaccine, which causes a dysfunction in platelet factor 4, in turn causing lowering of the platelet and conversely formation of blood clots. So if a patient who received Johnson and Johnson and AstraZeneca the same and gets severe headache, let him go to the hospital as quickly as possible and tell the doctor I had Johnson and Johnson vaccination because they cannot give heparin to this patient. He will bleed more. They have to use heparin alternatives, and one which I am familiar with we use is called Argatro brand. Not too many doctors know about it because you have to be an ICU doctor to know about it. So it is a serious disorder. You have to be familiar with it, and but it occurs 1 in 1 million, so very rare. So Johnson and Johnson is the only vaccine available to you, then get it. And blood clots are more common or only seen in women between the ages of 18 and 48. So now CDC had Johnson and Johnson include a warning on the label. Hey, women, if you are between 18 and 48, do not take it. So I hope, but the damage is already done. People are against Johnson and Johnson. And as you know, there is a vaccine hesitancy in USA. Almost 1/4 of Americans will not accept the vaccine, but it is based on political ideology, and I'm sure you know it, or it is based on ethnic background, or it is based on conspiracy theories that it will alter your DNA. So all those things are making 1/4 of Americans not accept the vaccine. And remember, we need 75 to 80% herd immunity. That means so many people, 75 to 80%, must have immunity either with infection or by vaccine to make the virus stop jumping from host to host because it keeps infecting, keeps replicating, it will keep mutating. So I don't know what to do about the quarter of Americans. By my talk like this, I'm sure you're going to tell your friends, hey, get the vaccine. It is safe. That is the only way to protect ourselves. Nothing else will protect you. There's no medical solution, no medical medication. Right now, only a vaccine will protect you. Mind my words. Mind the words of the scientists. I have been in communication with big vaccinology chief in my talks on the live webinar through Chet Foundation and American Medical Association. All right. Very quick word. I know I'm getting late. Very quick word. Uh, how long would the immunity last after you are vaccinated? Very common question which comes up in all the webinars. We do not know as yet. But we certainly think it will be 6 months to even as long as 1 year. Could you need a booster after a year? Yes, very possible. So keep that in mind. We do not know enough about the long term either adverse effect or the benefit effect of the vaccine as yet. Okay, quick word, and I'm sure this is a common thing. Holistic ways to prevent, because there are no medication other than vaccine to prevent corona 19. Okay, number one, I'm sure Pandit Ji will agree with me wholeheartedly. Healthy eating. We are what we eat. So healthy eating is very important. Number two, Exercise regularly. Even 30 minutes of walking a day will put you in good shape. It will boost your immunity and it will make you feel good by the endorphin chemicals which are generated in the brain. Number three, do pranayama again. Dr. Om Gandhi and Panditji will vouch for it. Pranayama has been shown to increase our lung capacities and oxygenation, including Om Vilom. Remember, people with a lowered lung capacity are more prone to lung complications with COVID 19. So keep your lung capacity high. Take deep breaths every morning, several of them, and do pranayama. And then, of course, again, Panditji will agree with me, meditation and yoga. So important, so important. Mindfulness, meditation, and yogic exercises. And lastly, but not the least, prayers. Prayers are very helpful. You know, I have a neurological disorder. I am alive by the prayers. And chanting of Gayatri Mantra. Gayatri Mantra has so many medical benefits, including increase in oxygen capacity and lowering of the heart rate variability and secretion of feel-good hormones, serotonin, dopamine, and oxytocin in the brain. I do chanting. As long as you can do daily, anytime. I even in the shower do the chanting of Gayatri Mantra. So please do that. It is not just for saying it, it is very beneficial. Okay, I'll stop at this.
Thank you so much, doctor. We'll start with question answers. So I will start with one. After the second shot, we do get fever. Is it recommended to take a like any Tanolone or something after that, or let it go?
Absolutely. Remember, after second shot, which is considered more immunogenic compared to the first shot, you're going to have higher adverse effect, more pain, more fever, more myalgia, body ache. Some people cannot tolerate it, but Tylenol in preference to Advil Aleve is much better. Use Tylenol.
Tanolone. Thank you. Yeah. Other
And
question,
more
please.
water, hydration, Tylenol. Yes, but it will go away in 48 hours.
Thank you.
Any other question?
Who is next?
Dr. Chander, I have a question. Like my family, very close family in India, my brother actually, their whole family got COVID, and their son is insisting. Like my brother is definitely getting better now, but the son is insisting to have CAT scan of the lungs, even though his oxygen level was good through and through. So, is it important to go through a CAT scan after having COVID, even though he's
But
improving?
he has recovered from COVID.
They, I mean, it's just 14, 15 days. They're like just recovered, like
But
recovery, but
no fever.
no
No
fever.
fever.
And even cough is like he said, like 90% better. But their son is very adamant that they should get a CAT scan of the lung and this and that. So, is it important or no?
Well, put it that way. Yes and no.
Yes.
CAT scan will document the pneumonia and changes in the lung.
Mm-hmm.
What are you going to do with those? You're not going to treat any better if you know there are changes in the lung so long the patient is already improving. If
Okay.
the patient is improving, no fever, doing a CAT scan is more theoretical rather than of practical utility. So that's the answer. Again, if the CAT scan shows you ground glass opacities in the lung, which are usual in COVID 19 pneumonia, the family is going to worry. Oh, your lung is normal. Maybe after 10 days, get another CAT scan to see will better. I
Oh,
would say if the person is doing better,
yes.
no fever, no shortness of breath, Oxygen levels are already up. Do not do.
Okay.
I will
Thank you.
read one question, Dr. Chander.
Thank you, Doctor.
I initially, in the beginning of the session, I read for you. Uh, how we instill the importance of not getting together without mask, even fully vaccinated, even if CDC recommends. As we know, in India, just because rules were relaxed, and now see what has happened. Are we waiting for a surge in younger age group, 80 plus? Why cannot they wait? What is the rush to enjoy?
The only way is education, education, education. I mean, what else can you do? I know, CDC now is recommending here that fully vaccinated people can mingle together indoors if all of them are fully vaccinated without wearing the mask. And outdoors, you can mix in smaller group, not in concerts or stadium. If there are some who are vaccinated and some who are not vaccinated. But in India, the situation is totally different. Here, 30% or 32% are fully vaccinated with both the doses. In India, only 2% are vaccinated. So in India, everything is risky without a mask.
Okay, thank you. Mhm.
So, Dr. Naresh, I have one question. Like you mentioned, like after 2 weeks, the person could still test positive even though it's recovering. On the contrary, if the person is positive and testing negative, so are there any symptomatic?
Positive and testing negative, positive in symptoms,
Yes.
positive for symptoms.
Yep.
That means the person is still symptomatic and testing negative.
Yes.
Before that person comes out of isolation and enter quarantine, person should be largely asymptomatic and have no fever for 24 hours without Tylenol. So
Mhm.
it is good that that test is coming back negative. That means the person is not going to be infective to others anymore. But you got to wait till the fever is totally down for 24 hours without Tylenol, Advil, or Aleve, and person largely has become asymptomatic. Then it is absolutely sure the person is fine and he will not infect others. But it's a very good sign person is recovering because that test is negative. But continued positive tests after 2 weeks when the person is fully asymptomatic does not mean continued infectedness.
Okay. Thank you.
Dr. Chander, what I have heard is that even though very few percentage of Indian population is vaccinated, but the vaccines there, they protect the virus B617.
Six.
Could 617, right?
Yeah.
Yeah. But could we get hit by B617 here and we will not be protected even if we are fully vaccinated?
You know, love, we really do not know because America or Europe has not done the genetic sequencing of the 617 fully and tried it against the present vaccine. Now, if India feels they're positive with the Indian vaccine from Bharat Biotech, which is very effective, as well as the AstraZeneca by Serum Institute, Poonawalla, who has parachuted and gone to England with his family because he was getting a lot of death threats.
Yes.
If India has already made sure that the present COVAX or COVAX are effective against 617. Have they done that testing already in the lab and vaccine against the 617? If they have verified that it responds to the vaccine, then it's fine. But America has not done that testing, neither Europe.
My second question is it safe to go to uh, gyms right now? I mean, if you go to gym, even they are disinfected every hour. They ask you to clean the machines before exercise and after exercise. Uh, and the pools and the saunas and showers in the gyms, are they safe
Yeah,
right now?
CDC is saying if you are fully vaccinated, and again, they're encouraging you, incentivizing you to be vaccinated. If you are fully vaccinated, you can go to these public places, but still mask up.
Mask up,
Still
yes.
take the precaution. But your chances of contracting the virus are very low. Only 0.008% people have gotten infected after fully vaccinated. So the rate of contracting after being fully vaccinated is very low. So you can go to the gym, saunas, and pools, provided you are vaccinated and you still wear a mask. I'll take the precaution. To me, travel is still, unless you really need to travel, do not travel. Because there are going to be people like you who are fully vaccinated, but there are others who are not vaccinated. So if you have to travel, which I do not advise anybody right now, wear the mask. You have to have a mask. Airlines do require even people who are fully vaccinated to have a mask.
Thank you. Excellent talk.
You are
Very
welcome.
nice talk. Thank you. Very knowledgeable, very informative. Thank you so much.
Thank you.
Dr. Chanda, before you go, I have last question like about the vaccination. If we are vaccinated and we still hear that the new variants are coming, and we mingle with the people who are vaccinated, but how do we make sure that the person who is vaccinated is not in contact with some new variant? It could come from India or from anywhere. So how much are we protected?
That is why they stopped travel from India to USA and Europe and Canada. I think Tuesday it will stop. Uh, we do not know enough about the sensitivity of the variant 617 or any other variant that may be there in India to our Pfizer and Moderna vaccine. So, but right now it's risky. I'm sure Dr. Kapila succumbed to a new variant in India, even though he was fully vaccinated. So, my advice is take still precaution when you do not know whether the variant is fully responsive to the existing vaccine. We do know that the UK variant, Brazilian variant, South African variant do respond to the present vaccine, though not to the same degree as the original virus, but they will protect you against severe disease. In case you acquire a variant, you will not need to be hospitalized or you will not be dead. I'm putting it bluntly.
Right, right.
That is the benefit even against the variant. But against India variant, we still have no knowledge.
So should we be worried more about the airborne? Like, let's suppose we are in a room and there are different people, even though vaccinated, or should we be more about worried about the like surfaces, like cleaning and so what would be the more like dangerous, or what would carry more chances of transmitting?
It has been now shown by CDC
Hmm.
that the surfaces, we used to worry about grocery bags and other parcels which are coming through Amazon, whether we should touch them or we should first clean them with a Lysol wipe. Now it has been said you do not need to clean them.
Okay.
Chances are you are acquiring a virus from a parcel package or a bag are extremely low. So you don't need to clean them up with a Lysol wipe. Now, your second question was mixing with people, right?
Mixing, or suppose like if I'm going to a restaurant, like inside, it's like very scary situation. Like I don't feel comfortable sitting there just thinking that what if somebody has come with a different variant and it's still in the air, like, and the door is not open, so I feel very uncomfortable. We don't go, we avoid. So how safe it is to go in a room or in a dining, indoor dining with vaccination, after
I,
vaccination?
I would suggest right now
Mhm.
do outdoor dining. Be outdoor in
Okay.
a restaurant.
Mhm.
Safer. Why take a chance mixing with people? Are you going to know everybody who is vaccinated? Are you going to ask them? No, it's
No.
not possible. Within your own home, if you know everybody is vaccinated, even among your friends and family, mix without masking. But outdoor area in a restaurant, I have no problem. But indoors, you got to be very careful that they are not carrying a variant which may not be fully responsive to the vaccine. Even though if you get the variant, you may not fall that sick. But we do not know about India variant. We do know about the UK, South African, Brazilian, and Californian variant, but we do not know enough about the India variant.
Thank you
Dr.
so much.
Chander, I have a question.
Yes,
Do we have to eat out? Can't we stay home for another 6 months?
absolutely. Sushma, I could not agree with you more. I've not gone out since
We
last.
haven't gone out too. So I'm saying,
Why take a chance?
That's true.
Even outdoor, why take a chance?
Right.
right, stay home, enjoy
Eat
it.
at home, your own organic home food.
Yes, I know.
Do you think they supply
Food.
you organic food? No, I would
We
not.
don't have to meet friends. We have a lot of friends. We see friends on the Zoom. We don't have to go out. Stay home.
Very right.
We've
I
done enough for 40 years
could
now.
not agree more with you, Sushma.
Thank you.
Dr. Chander, this is Ram Sini. Question is, can vaccination cause infection? Because some people are not getting vaccination, fearing that it may cause the infection. Is that true?
Answer is absolutely no, with a big no.
Yes.
No vaccine has a fragment of the virus like in a flu vaccine, which is attenuated or killed vaccine, but it has a virus. COVID-19, none of the vaccines, either Moderna, Pfizer, or Johnson and Johnson, have COVID-19 even fragment. The mRNA have computer generated, made by the computer, mRNA molecule without the virus. So it will not cause COVID-19 disease. Please tell your friend.
Thank you, sir.
Dr.
Take care.
Chandra, Dr. Chandra, this is Sudesh Kapoor. I have a very quick question. We talked about, you were mentioning about the long haulers who may have been either exposed to COVID-19, either asymptomatic or they may not have known they had COVID, but some tests of theirs showed increase in ESR, C protein, showing there was increase in inflammations in their body, possibly due to some exposure to it, but nothing could be done at that point. Now, as they went along and they did get vaccinated, the side effects after the vaccination, somehow or the other, mimic the same side effects they had the ESRs had come down at some point during a period of time. But after the second vaccination, inflammations again came on the rise. Um, Neurological problems had started to arise. Now, is that something that, again, is a long haul for them as a side effect of the COVID-19 vaccination? Or is it something that no doctor has been able to um, come to a specific saying that it could be the vaccination? All they say is it could be an pre-existing condition of yours, but not the vaccination. Vaccination side effects go away within a couple of days. But I personally don't believe it. But what
Okay.
is your take on that?
Are you talking about somebody in America, USA?
America, yes.
And that doctor is not able to answer that question?
They basically say any side effect of vaccination um, would not
Very
be.
limited, very limited. Even after the second dose, which is much more immunogenic, causes more side effects. They're limited to 2 or 3 days at the maximum with the vaccine. So the symptoms and the elevated markers are due to the long COVID from before, not due to the vaccine.
So, but even if their ESR had come down to normal and then after vaccine it got elevated again?
Vaccine has so far not been shown to elevate any one of the inflammatory markers. So it is a non-specific thing which causing. Is the C-reactive protein also more elevated now?
No, C reactive is
That
okay,
that
but the,
rate, that rate is non-specific, not as specific as the CRP.
okay. Thank
So
you.
also ferritin level, troponin level, I'm sure are normal.
Ferritin meaning,
IL-6, interleukin 6 as a marker probably is normal.
and I'm not sure about that, but
Okay.
yeah. So no, I appreciate that.
Fat rate by itself is a non-specific.
Okay, thank you. Thank you, Dr.
You are very welcome.
Dr. Chander, I heard you saying that the vaccine should not cause infection. One friend of mine, I just want to reconfirm, one friend of mine in India, she said she get allergic reaction to many medications. So she's afraid that if she takes COVID vaccine, will it cause her reaction?
Okay. Very common question. Is, how severe is an allergic reaction to anything? Is she mildly allergic with a little hives, urticaria, itching, or
I
does
think
she get
she
it with
almost had to go to hospital, I think, with some medications.
yeah, with some medication? You know, this is a tricky situation. We do advise anybody with a severe underlying allergies, particularly to the components of the vaccine, not take the vaccine. We do tell them. Now, if after one dose or the first dose of Moderna or Pfizer, they had an allergic reaction, severe, I'm meaning severe, they should not take the second dose. In that case, experts are recommending wait 28 days and then maybe you can take the Johnson and Johnson. But you have to wait 28 days
Oh, okay.
because
Thank you so much.
immunity will not be complete after one dose.
Mhm.
So,
Okay.
but you can take J&J because she may not be allergic to the components in J&J. One component in Pfizer and Moderna, which has caused the allergic reaction, the sole component is PEG, uh, PEG polyethylene glycol. Polyethylene glycol is the same thing as in go lightly for colonoscopy or Miralax as a laxative. So many people do have allergies to PEG. Now, PEG is a lipid molecule, and the vaccine molecule of the mRNA is wrapped in the PEG encasing before it is injected in the muscle cell because PEG wrapping confers it more stability. So if anybody is known to be allergic to PEG, Moderna and Pfizer are total no. In that case, she can take Johnson and Johnson using
Okay.
totally different technique, or AstraZeneca, which is the same exactly as J&J, but has not been approved in USA as yet. India has AstraZeneca manufactured by Serum Institute, owned by Pulmonologist.
Mhm.
They are
Thank
all
you
very
very much.
good vaccines.
So, Dr. Chander, just last question. After you get COVID, if somebody gets COVID, how many days that person should wait for vaccination?
Okay.
Antibodies are already there in the body.
Very common question.
Mhm.
They used to say wait 30 days.
Yes.
But now they are saying, CDC and FDA are saying, when you get asymptomatic and the fever is down, you have no active symptoms, you can get, you are out of isolation, you get the vaccine. No harm. But if you receive monoclonal antibodies for the COVID-19 infection,
Mhm.
you must wait 3 months before you get the vaccine.
So, how do we know that the person has got monoclonal?
No, but wouldn't you ask the person is known contact or a relative or a friend of yours, you would ask, did you get the monoclonal? India has no monoclonal antibodies.
Okay.
India does not have it. Otherwise, a lot of patients could have survived.
Oh, okay.
So, most likely she did not, or he or she did not get monoclonal if
Mhm.
the person is in India.
Okay. Okay.
Not every country has monoclonal.
Okay. Thank you so much, Dr. Chander.
You are very
Very
welcome.
helpful information.
Anyone else has any questions?
How many people are here today? Only
There were
one.
26 people, doctor, that time.
Okay, that is good. At least as many people who can get the clear information, better for all of us.
We have recorded the session also, doctor. We'll spread it to more and more people.
Very good.
That is
Thank
the
you
plan.
very much.
Thank you so much. It was very knowledgeable, very informative. Great talk. Thank you so much.
Good, thank you.
And we really appreciate your time, doctor. Really appreciate it.
So much.
Thank you.
Thank you so
Naresh.
much.
Thank you for
We
your
really appreciate. Thank you very much.
Thank you.
Thank you very
Thank
much.
you, doctor.
Naresh, it was very informative. Thank you very much.
Thank you,
Thank you,
Om.
doctor.
I was hinting at Pranayama that you are an expert in.
Thank you, Dr. Chander.
Do it. So thank you.
Thank you, Dr. Chander.
You are very
Thank you,
good.
everyone.
Thank you, everyone. Thank you.
I hope
Thank you, everyone. Take care. Stay
my
safe.
voice is a little impaired because of my neuro. I hope it was clear enough for everybody to understand.
Yes,
It was
yes,
very
it was
clear,
very
It
clear,
was good.
very good.
helpful information. So we really thank you.
It was
Thank you,
very
doctor.
clear, Nareshji. It was.
Very clear.
Indeed, it was really clear.
Very
Thank
clear
you.
in layman language.
Yes.
Yes.
Very,
We are
very
all
clear.
laymen. We are all laymen.
Yes.
I mean, not in scientific language.
Yes.
Yeah.
Thank you.